Hi, everybody. So we're back. I hope you had an amazing service and that it was inspirational and that you'll take home that message and spend some time in fellowship with God this afternoon. And so right now I'm going to talk to you about vaccines. So what are the vaccines? Are they safe? Are they going to alter my DNA? What are they made of? Why are people having allergic reactions? Is the government doing experiments on us? Let's address some of these questions. So first, I'm going to show you a quick video on some of the vaccines that we've been using for years, and then introduce you to the concept of the new type of vaccine that they're using for the current vaccination programs.
Vaccines prepare the immune system, getting it ready to fight disease-causing organisms called pathogens. A vaccine is introduced to the body to mimic infection, triggering the body to produce antibodies against the pathogen, but without causing the illness. Conventional vaccines usually contain a weakened or inactivated pathogen, or a piece of a protein produced by the pathogen called an antigen.
So let me explain these vaccines.
RNA vaccines are a new.
So we have these conventional vaccines, and these are the vaccines that pretty much folks in our community haven't really had an issue in taking in the past. We are not anti-vaxxers for the most part. So what's the weakened pathogen? That means that there is a piece of the virus that is alive, but it can't cause disease. Why do we need it this way? We need it this way because we do need the virus to be able to express certain proteins that your body can make antibodies towards. Then you have inactivated vaccines. These are like the hepatitis B vaccine that children receive when they're born at 2, 4, 6, usually 9, and then 12 months. And it's given in that series because of the way that the body's immune system works. Children are not able to make memory immune cells until about 9 months. And then that's why we give this weakened pathogen at 12 months, because their body will really be able to make that memory and will be able to handle this, this weakened virus. Their immune system is strong enough to do that. Now, there's another conventional vaccine that uses just part of the cell. So they just take a little slice and it's injected into the body, so you don't have to use the whole thing. And then ideally, you can use one virus for multiple vaccines. So you give a small piece and you'll get this. So if this is the coronavirus, the spike protein here, and also a part of the nucleocapsid, that's this circle that's around this squiggly mRNA that is here inside of this cartoon of a pathogen. So essentially, your body will create antibodies to the particles that you see here. These are proteins. So this is the conventional type of vaccines that we have. I also want to mention to you that the development of vaccines actually originated in Africa, in countries in Africa, and it's something that our ancestors have been a part of doing for years. So what they would do is someone who was sick, they would give a person a small inoculation of whatever they were sick with, usually some of their mucus from their nose, and they would put it on a little portion of their arm, and then the body would be able to make antibodies towards that. So this is knowledge that was given to us previously on how to keep the whole population healthy from viruses or bacteria. Now let's learn about what are the mRNA viruses.
Generation of vaccines. Instead of the antigen itself, RNA vaccines contain a messenger RNA, mRNA, that encodes for the antigen. Once inside the body's cells, the mRNA is translated into protein, the antigen, by the same process the cells use to make their own proteins. The antigen is then displayed on the cell surface where it is recognized by the immune system. From here, the sequence of events is similar to that of a conventional vaccine. Some RNA vaccines also contain additional mRNA coding for an enzyme, which, after being translated in host cells, can generate multiple copies of the antigen encoding mRNA. This essentially amplifies the production of antigen from a small amount of vaccine, making the vaccine more effective. These are called self-amplifying RNA vaccines.
Okay, so I'm going to take you through really quickly. We're going to just review how this works again in the cell. Right, so here, this little yellow line represents an mRNA. So we see what will happen is that this mRNA will come into the cell. It also has a small capsule that it's in. It's a lipid capsule, sort of like a fatty capsule. Then it comes into the cell. Here it is. This mRNA is being translated to antigen. Now your cell is constantly checking itself to see if it's good and disease-free. So it takes anything in the cell and says, look at me, am I clean? Am I good? Am I good? Am I clean? And if it puts this antigen on top of the cell here, then it's going to signal the body that it has something foreign in it. So what happens then is that your immune cells will come, identify this, and then it'll show it to other cells in your immune system. Then those other cells will make antibodies, or there are cells that actually will come and attack the cell and kill it. And so that is how this type of vaccine works. And when you get a normal virus infection, that's actually how it sort of works as well. The virus with a normal infection will actually come and it will utilize your DNA to reproduce. This is a normal virus. This is everyone who's gotten the COVID-19 virus, the SARS-CoV-2 virus. This is what happens. It enters into the cell, it sort of hijacks your own DNA and gets it to produce its DNA or mRNA. And then this antigen is created. It is put here on the cell. And then it's identified by your immune system as a cell that has been compromised. And your immune system then will go and kill the virus infected cell. And so why are people tired? They're tired because, one, their immune system is ramped up and it's working really hard, and that takes a lot of energy. Number two, they have cells that are dying. Why is there a fever? You get a fever because your body is increasing the temperature to try to destroy the proteins and the mRNA that are in these viruses, or the RNA that's in these viruses. What else? I'll talk a little bit more about the side effects when we get to the specific vaccine types. So what are the vaccine companies and which ones are currently available? So right now, the ones that we have available are the Moderna vaccine and the Pfizer vaccine. So both of those vaccines use mRNA. They're mRNA vaccines that will use this method of taking this antigen and showing it to the body. Okay, next, what about some of the other vaccines? The Johnson & Johnson vaccine, the AstraZeneca vaccine as well, is using a DNA type of technology or mechanism that will allow the cell to produce the mRNA. So that it's not the mRNA entering itself, it's the cell is going to produce the mRNA just like a normal virus would work when it enters your body. It'll produce just this mRNA, and then it will do the same thing, make this antigen, and then show that antigen that's foreign to the rest of the body, and the body is going to sense that, oh, this is foreign, this cell needs to be taken out, it doesn't belong here, it's infected, it has to go. So you can kind of think of this as, when those zombie apocalypse movies, when someone gets affected, you're not going to sit there and be friends with them, right? You've got to take them out. So that's what the body does. It takes out infected cells. Okay, the next vaccines that are in the pipeline are the Novavax vaccine and the Sanofi vaccine. Both of those vaccines will use a portion of the virus, the spike protein, and I believe that the Sanofi also use part of the nucleocapsid to produce the antibodies. This type of vaccine never enters your cell. It only enters your bloodstream, and in your bloodstream, there is, in some of your tissues nearby, but it gets into your system, and you have white blood cells that are in your bloodstream. And so it's going to identify this spike protein and the nucleocapsid as foreign, and it's going to create that immune response. Now, again, why do you have some of these side effects after getting the vaccine? When there's something in your body, again, your body has to shift its energy to fight this pathogen. So you're going to feel tired. Also, your body is going to raise its temperature because it says
is similar to that of a conventional.
It says that I'm under attack, and then it's going to try to do what it does to fight bacteria and viruses and fungus, which is to increase the temperature. Again, to try to break down those proteins and kill the virus or bacteria. What else happens? Your body can feel sore as well in the area where you were injected, because in that area, there is increased fluid that's building up in that area. So if you've ever had like a bruise or something like that, you notice that, of course someone hit you and it was flat, and then it sort of builds up, right? And you can get like a raised portion. Well, there's a lot more fluid going there, and that fluid is stretching, your vessels and your tissues. And so that's actually what causes that extra pain. And so essentially that's how these work. And we hope to be a part of a process to do mass vaccination using this Novavax vaccine. We're also in the process of, we are already a site for a clinical trial using the Sanofi vaccine, which is this one at CDU. And again, I was on another forum and I let everybody know that I would not feel comfortable putting something out in the community that I wouldn't take myself or that would harm the community. So I went to high school at Long Beach, Jordan, just down the street from the church. I ran track at Compton College, and during our track meets in high school, and practiced there on the weekends. And so I'm speaking to you as my friends and family, my community. And now with Pastor Esther's, knowing that we have that family connection, we're really family. So I would not advise my family to do something that was not safe. And so you'll be getting more information about that and how to be involved in it if you would like to in the future. But again, these two vaccines, the Sanofi and the Novavax, they don't need the same refrigeration as the mRNA vaccines do, and they can actually be stored in a normal refrigerator. Looking at the way that we may do this mass vaccination, it might be a good strategy for us. And so why do we need to get vaccinated in the first place? Because we need to build up the immune system to be able to fight this virus. We've seen that people who've been infected with other coronaviruses, and that's just a cold virus. It's just a cold virus. And so those individuals still have some of those antibodies that will still recognize part of the coronavirus that's the same in the previous copy of the virus versus this new copy or this new strain of the virus? That's another question. Will the vaccines be effective against the different strains of the virus? Well, they believe that these will, but again, this is only showing the S protein. The other vaccines have the S proteins and likely a piece of the nucleocapsid as well, and antibodies can be produced against that. And so they're pretty confident, the researchers from these companies, that the vaccines will be effective for the new strains of the virus that occur. How many times do you need to get the vaccine? Well, we know that if you want longer term immunity, longer than 3 months, you need at least 2 vaccines. So you'll get 1 vaccine, and then 21 days later, you'll get a second vaccine. And it is possible that after a year, you may need another vaccine. So again, this is a completely new strain of the virus that's been introduced into the human population, and we don't have the immunity or significant immunity to it. So that's more about vaccines. Some of the other questions that people have had is, are they going to take a copy of my DNA or change my DNA? That's not going to happen. Is the government putting a chip inside of me? Is this sort of like the marking of the beast? That's not happening, especially since if you think about the vials, there's more than 1 dose in a vial, and you're only getting a little card. They're not necessarily recording it on a nationwide computer per se. And so they're not going to track you. There's no technology to do it that way. If anything, the government is tracking you by your cell phone, which, can hear everything that you say, which is why when you start talking about a particular topic and you go to your Google search, it comes up. So that is the way that the government is tracking us right now. So does it do it through the vaccine? No, it doesn't do it through the vaccine. Other side effects. One of the side effects that happens with any viral infection that you have, and that's if you just get a viral infection, is that there's a possibility for autoimmune diseases. That's generally what happens. The vaccines that use this technology with either DNA or mRNA, because it produces this this cell here, or the cell puts out a piece of the virus, what can happen is that it will see something that's yours and associate the two. So it's sort of like, okay, this guy, or this girl was standing next to this person, but it's this person who gets hurt. You know what I mean? And so the body's going to see, oh, this thing that's self, and start attacking that. So that's how autoimmune diseases develop. So who shouldn't take the vaccine? There was just a study that was, or cases that were released that were showing that those who were over 80 years old were having or passed away after getting the Pfizer vaccine. So why might that have happened? That happens not only because, or not because the body made immune antibodies towards this S protein, but one of the other things that happens is that you have cells in your body that are dedicated again to killing these cells and taking them out. And so this mRNA might have entered certain cells, and their normal cells went to attack these cells, and it could have attacked too many. So that's one way that they could have passed away. And that's sort of the way that people are passing away in general from this vaccine. I'm sorry, not from the vaccine, from the virus. That's how people are passing away from the virus. The cells are infected and they're being identified, and they're being killed. And after they're killed, they release all of this stuff, and then more of the immune cells come to that area. There's more swelling, and that causes problems, of course, for the lungs, and then for other organs as well. It's important to know that this is called a beta coronavirus, and it not only attacks the lungs, but it attacks vital organs as well, such as kidney, liver, and heart. What are some of the long-term effects of having COVID-19? Well, your body has been damaged because there was a war that went on inside your body. So it's going to take your body time to heal. So even after you've been exposed and you might have gotten better, it's important to do all that you can to prevent or to rest so that your body can continue to heal. One of the things that you guys wanted to know is what can you do? What else can you take to help your body, to help your immune system? Number one, before getting sick, you should make sure that you are taking your vitamin D supplements and a multivitamin. The multivitamin should have vitamin C, vitamin E, B12, and zinc as well. Okay, you need to make sure that you have those basic vitamins. We need vitamins and minerals for our basic functioning of our body. And when we don't have the right vitamins and minerals, then we start to develop different problems and different diseases that can be cured with replacing the vitamins that we lose or that we don't consume. The other thing that you can do is a lot of people have been asking about, what's this onion soup that I've been recommending, and is there any science behind it? Of course, the FDA and other people say, oh, no. But at the beginning of this pandemic, I really took the time to sit back and look at what was happening. I asked God to show me how everything worked and how we could combat this. And then he brought to my memory this soup that a friend who was also a physician told me about almost 18 years ago. And essentially, there are certain fruits and vegetables that have antiviral properties. So let's think about this a little bit. So some of you guys have had a garden and you've seen that snails or grubs will eat through some of your vegetables and or some of your fruits. What do fruits and vegetables have on the outside? They have this skin, and sometimes it's bitter, right? Even an apple can be bitter, like the skin can be bitter. So what is in that apple? What is in that lemon peel or orange peel that makes it bitter? It's essential oils. And these essential oils have a compound called quercetin. And this quercetin compound is actually what prevents worms and flies and other things from getting through the outside of that fruit to the inside of the fruit. So that's its defense mechanism. And so in their skin, they have these antiviral, antibacterial, antifungal agents. And so, one of the things that we're supposed to eat is fruits and vegetables, right? With the skin on for some of them. And so one of the ways that we can get those essential oils out of the fruits is to boil it. With onions, the red onion in particular, there's a high concentration
vaccine
of this.
Some RNA vaccine.
Let me stop my screen share here. There's a high concentration of this quercetin molecule. And once that onion or even a lemon, once it's been boiled, then the essential oils will be in the juice. And so for my recipe for what's, this onion soup that Dr. Young's been talking about, this is something simple. I sort of relate this to how the general from Syria went to see Elijah, and Elijah told him to bathe in the Jordan River 7 times. And the general said, "Why would I do that? Aren't the waters of Damascus cleaner?" Or I thought you were going to do some sort of, magic stuff and bring down the heavens and, then I was supposed to be clean. But he said, go and bathe in the river 7 times. And one of the things that we see is that he was not willing to do it. He wasn't willing to do something simple. But his the person that was working with him said, hey, if this was something hard, wouldn't you have done it? If it was something difficult. So if you would have done it if it's hard, why wouldn't you do it if it's simple? So sometimes we as humans, because we're facing something that we don't know and we don't understand, we want something complex. We want a complex, expensive solution. When you ask God, well, how do we fix this? What do we do? It can be something really, really simple. And so, again, this is really simple. And so here's the recipe. So you take a red onion and you cut it into 4. After you cut it into 4, you place it for 1 onion in about 4 to 8 cups of water, depending on how strong you want to be and how much you're going to be drinking. And then you boil it for at least 20 minutes. And that allows the essential oils to come out of the portion of the onion that contains the essential oils. Then you can drink that. I always add just a little bit of salt and a little bit of sugar just to help make sure that the oils can enter the cells really easily and get into the system really easily. And then you just drink that. And if you want, you can make it for more people. I would say 1 onion for every 4 people if you're just going to have 1 serving. If you're going to have multiple servings of it, you can create even a larger pot. And you want to do this for a minimum of 3 days. Minimum of 3 days so that it gets all through your system. So a cup in the morning and a cup at night for a minimum of 3 days. If you go somewhere and you think you might have been exposed, just go grab that onion, chop it up and make it. So I've always got red onions in the house. If I've been somewhere or, the weather's kind of up and down right now, it's hot and cold, I'll just make that for myself and my family. And then usually within a day or so, any sort of tingling I had in my nose or a little drip of mucus will go away. And so that's the onion soup recipe. I'll also give it to Pastor Esther's in email. And again, we are available if you have any questions. We do want to emphasize that more than ever, as much as possible, stay home. Let your family members bring food for you. If you have to go out, wear an N95 mask or at least a surgical mask. And we will be seeing you hopefully at the church. We are hoping to open a testing site on Saturdays at the church and eventually be able to bring the vaccinations to make sure that our community has access to these resources that the government has spent billions of dollars on. And so we're going to keep working and keep advocating for you. All right. Take care, everyone, and have a happy Sunday.